Welcome to the podcast. I got a really amazing show for you guys today. Actually, I met Dr. Balfour, who I'm going to introduce you to in a second, because I had an issue with my own dog. So it's not like I just read about this guy and heard he's amazing or anything like that. I actually had him treat Maya the flying papaya, who had an injury, and we're going to talk about that today. So glad you're here. Glad you're following the podcast. And today's show is with Dr. Raviv Balfour. Thank you for being here.
Thanks, Robert. I appreciate it.
And we first met, was like maybe a couple years ago, when my German Shepherd, Maya, had an injury, and I didn't know what it was. I mean, I kind of knew what it was, but I didn't really know what it was. And some of you guys may have had this, and it's one of those things where you see your dog doing something peculiar, and you know the dog, Maya, was lifting her leg, and I had no idea why. I thought maybe she had a thorn, she pulled a muscle, and all these different things. And then I finally sought out, as I always do, the very, very best in the field, and found Dr. Balfour. And I brought her in, and you examined her, and you determined it was a
torn cranial cruciate ligament.
Okay.
So this is, one of the more common injuries that we see in dogs. In fact, it is the most common orthopedic injury that we see. And often it presents with the dog, maybe holding up their leg. Sometimes you can get a partial tear of the cruciate ligament, and the lameness will be more sporadic.
Okay.
It'll be worse after doing some activity, and then when the dog rests up, they don't tend to limp as much.
Okay.
So sometimes, people are, they kind of watch to see how their dog does for a while before having them examined to see. But then when we examine the dog, it's a pretty straightforward diagnosis because, first of all, I can feel swelling within the knee when I put my hands on the knee, and then we feel for instability of the knee. Because basically what the cruciate ligament does is it prevents forward movement of the tibia as well as internal rotation. So when a dog tears their cruciate ligament, then I can feel the instability of their knee and thus make the diagnosis.
Okay, so it's called an ACL, right?
In people, technically in people, it's called an anterior cruciate ligament because when we stand, we have anterior posterior.
Right.
In dogs, because they're down on all four, actually they don't technically have an anterior, so it is the cranial cruciate ligament, but that is the exact same structure as the ACL in people. So the same structure that football players and skiers tear all the time.
Okay, but the proper term for a dog is a CCL.
Correct.
Okay, so it's not two different injuries.
It is not.
Okay.
It's the exact same ligament. I tend to call it an ACL, but the technical term is a cranial cruciate ligament.
Okay, so it's still on the anterior of the leg.
Correct.
Right? Okay, and since you said it's a very common injury, and Maya's a German Shepherd, and she's a working line German Shepherd, so she's more square than a lot of the other German Shepherds, which are more angulated. And a lot of that angulation, I think a lot of people don't know, but that is a stacked position that the dog is put in to show that conformation. And true, some German Shepherds do have much more of an angulation than the working lines do. But is it more common in any kind of specific breed?
Yeah, it's funny because German Shepherds, with the more angulation, the more kind of low that their rears are, I don't tend to see this injury as much. I tend to see this injury in much kind of taller, skinny leg dogs. And I feel like basically when we make dogs taller, that hyperextends the knee to some extent. And hyperextension is how you stress out the cruciate ligament. Okay. So for example, when we're on skis and you plant your ski and you hyperextend your knee, that's when we tear our ACL. So if you take a very low slung German Shepherd dog and we make them kind of a little bit more upright, the rear is a little bit taller, that is basically hyperextension of the knee. So in terms of the breeds that we tend to see this more commonly in, think of the breeds that have become taller over the years. Labradors, to me, are one of the very typical breeds because when you look at the original English Labrador, very short, very boxy, and then as Americanized, they're kind of become these taller, kind of prettier dogs, but stresses their knees.
Right.
Same thing with a lot of the bull breeds nowadays. Now that we have American bulldogs, these pit bulls, that are being, bred with Labradors or other dogs, the short, stocky little Staffordshire Terriers are now becoming taller.
Yeah.
And that is hyperextending the knees. And if you have a little bit of bow to the legs, like you see in a lot of the bully breeds, that also puts some stress on the internal rotation of the leg. That combination together is deadly for the cruciate ligament.
Wow, that's fascinating. I mean, I always wonder, are there activities or is there something that people do not knowingly? Maybe they just enjoy running with their dogs or hiking with their dogs or anything like that. Is there a specific, let's start first of all just with pet owners.
There isn't any, it's interesting because the history that I get from owners when dogs tear their cruciate ligament ranges all over the place.
Okay.
So there's not a specific activity that leads to dogs tearing their cruciate ligaments. I see it sometimes in dogs who are couch potatoes. I see it sometimes in dogs who are hiking 10 miles a day. Sometimes it's from jumping off of a couch. Sometimes it's running around a backyard. Sometimes, it's from running 10 miles with their owner. And again, I feel like it is such a prevalent injury in dogs that the conformation combined with activity can lead to the injury, but really no specific injury that I can usually pinpoint.
Interesting. Is it one of those things, like I'm very active, I did martial arts for years. I always think that if you keep your muscles strong, it tends to support the ligaments and the joints. Is that the case?
That's always the case.
Okay.
I feel like, not only that, but it does tend to lend to a better recovery when you have support of the muscles, because muscles provide what I would call passive stability to the leg. So when you have your quadriceps and your gastrocnemius, your calf muscles, they come around the knee, and they provide a passive stability versus the cruciate ligament, which really provides an active stability. But when you combine that together, then it certainly helps.
Okay.
But again, I see very well-muscled pit bulls, who still tear their cruciate ligament.
Right.
So it's definitely not a fail-safe, but I do feel like it does help with recovery.
Okay. And one of the things I just want to touch on recovery, I didn't even think to ask you this question. I'm a big firm believer as a trainer that dogs should be crate trained, that they should at least understand being in a crate is not a punishment. And I've done it with my dogs since they were puppies. And I remember you said that for 2 weeks, you didn't want her active at all.
Yeah, it's every surgeon is a little bit different. Every dog is a little bit different, in terms of level of activity. I agree. I crate train our own dog, and but I don't necessitate being in a crate after knee surgery.
Okay.
And part of that is because some dogs are actually worse in a crate.
Right.
And, they can go a little bit more crazy. And so it truly depends on if they have been brought up that way and to think of it as, oh, hey, I'm just hanging out in bed versus a punishment.
Right.
And, in which case, then sometimes it's actually worse.
For sure. But if they are crate trained, it's a really nice way. I noticed I was able to keep her in a crate. She was totally chill. And it was amazing to me how, I dropped her with you and I picked her up that afternoon. Or was it the next day? The next day.
Yeah.
The next day I picked her up. And it was just, I was amazed. It wasn't a big deal.
Yeah, a lot of people, certainly they get scared by reading stories on the internet, as we all do.
Sure.
But unfortunately, when people tend to be super happy and things go really smoothly, that's not the people who go on the internet.
Yeah, that's always
so
the case.
You tend to see the worst of the worst. But I would say that the vast majority of the time, recovery after surgery does tend to be pretty smooth.
Yeah.
The dogs bounce back pretty quickly, use their leg relatively quickly. And, the hardest part really for people is trying to restrict their dog's activity.
Yeah, that was the hardest thing with her with Goofy. So this is what you do as a procedure called TPLO.
Yeah, so when dogs tear their cruciate ligament, again, this isn't a diagnosis that's made on an x-ray.
Okay.
On an x-ray, we can see swelling within the knee and assess some arthritis, but you can't see the cruciate ligament itself.
Oh, wow.
So this is truly a diagnosis that's made on feeling instability within the knee, putting our hands on the leg and feeling it. When you have instability in the knee, the problem is that in dogs, because of the angulation of their leg, that the knee very rarely becomes stable over time.
Okay.
Sometimes with people, because of our upright stance, we still have a pretty stable knee.
Okay.
Sometimes we can get away with braces. Okay. Sometimes we can get away with physical therapy. And depending on what kind of athletic function we want to get back to. But the biggest difference is that our tibia is straight across.
Okay.
Has a very flat plateau is what it's
called. You've got samples to show this, right? So we can.
Yeah, I do. Well, not a human, but for dog, yes. But in dogs, they have a tibia that slopes downwards.
Okay.
And what that means is that when they put their leg on the ground, there is constantly a forward push to that tibia. So when they get to the point of having instability within that knee, if we don't stabilize it with surgery, it's going to lead to a lot of arthritis within that joint, because that is the body's response to try and stabilize the joint that is unstable.
Right.
So in order to do that, there's several different types of surgeries that have evolved over the years. In people, and anyone listening to this podcast who has had their ACL repaired is probably most familiar that in people, they tend to replace your ligament with either part of a patella tendon or quadriceps tendon or a cadaver graft, depending on the surgeon and your situation.
Right.
Now, when we used to put a fake ligament or basically an intra-articular repair, where we would put something back into the joint to mimic the cruciate ligament, it would work great for a little while, but the problem is then these dogs would go run and they would end up tearing the new ligament.
Wow.
And so it became a problem because obviously people did not want to do the same surgery multiple times on their dog.
But why did it tear the ligament?
Because the problem is that you put in a new ligament, which often is not going to be, the materials that they use for these ligaments are improving certainly over the years.
Right.
But it still does not tend to be as strong as the original ligament.
Okay.
And so people have tried a lot of different things to strengthen that ligament, in terms of, putting stem cells and PRP and, various things, because there is no blood supply to that ligament. So it's only as strong as the material that you put in there. And of course, again, part of the conformation and the activity of the dog is what leads to the tearing of the ligament.
Wow.
So it will often tear the new ligament as well. So the original surgery that became very popular for repair of knees is what's called a lateral suture. And what this basically is a very heavy gauge suture material put on the outside of the knee, which holds the knee in place. And that works great in cats, small dogs. But the problem is that as dogs get bigger, it's very difficult to hold that knee in place with this lateral suture. So in the early 1980s, a surgeon up in Oregon, Barclay Slocum, who had made some very amazing surgical techniques for the veterinary field, described a new surgery that he had basically taken from the human surgical field for various deformities in people with tibial problems, and it's called a TPLO. That stands for tibial plateau leveling osteotomy. So basically an osteotomy is a cut in the bone in order to level the tibial plateau.
Okay.
So basically what this surgery does is if you look at a dog's tibia, okay, so this is looking at a dog's tibia.
Okay. And the tibia is the lower.
So yes. So if we were to look at a knee,
right.
So this is basically looking at a dog's knee,
right.
And this again shows the angulation compared to a human knee, which is very upright like this. But this is more of a dog's knee, and they have this tibia that slopes downwards like this. So again, looking at kind of the bottom tibia here, when the knee is like this, this is the shape of the tibial plateau. And so there's constantly this forward push in this direction, which is what the CCL prevents.
Okay.
So what we do is we make a cut in the bone. This is the osteotomy.
Okay.
And we rotate this tibia to flatten that tibial plateau. So basically this downward angle, and we level it. So if you take a look, basically this is what it looks like after we've done the surgery, is we've made a cut. We've rotated this tibia. Here's about how far we've rotated it.
I see.
We put a plate to hold it in its new position, and now the tibia is flat compared to how it was before.
I see. Wow.
Okay. Now, once we do that, what happens is the force in the knee is now coming straight up through the tibia as opposed to going forward.
Right.
So what that does is we are actually using the dog's weight to stabilize their knee as opposed to putting something in the knee to replace the cruciate ligament, basically, which is fighting their weight.
And this is the cruciate ligament.
So the cruciate ligament is actually in purple right here. It's it's very difficult to see in this model. But so the nice thing is that once we level the tibial plateau, the knees become stable without actually needing a cranial cruciate ligament.
Wow.
And the reason is there's no forward motion that we now need that ligament to prevent.
So the ligament is actually taken out.
So yeah, well, the ligament is torn. That's
Right.
why we're doing the surgery, and we basically go and clean up the torn portions of ligament. And there's, ligaments don't have blood supply, so there's no way to put the ligament back together again.
Oh, it has no blood supply.
There's no blood supply to ligaments.
Wow.
So that's why there's no healing of ligaments.
Okay.
So once we finish the TPLO surgery, the knee becomes stable without a CCL.
Wow.
So the nice thing is there's nothing that can re-tear down the road. We're basically just changing the way the force comes through the knee in order to make that a stable knee. And again, relying on some of the other more passive structures of the knee to help with stability. So once this bone heals in this new position that we've rotated it to, that knee will be stable for the rest of the dog's life.
And so it's very interesting because I had no idea when you explained it to me what it looked like because I didn't get to see the samples.
Yeah.
But and I have this on my keychain here, by the way, because you later went in and took out the appliance.
Yeah. So a lot of people ask me, what is the biggest complication of this surgery? And it's a very successful surgery. 95% of dogs plus improve with the surgery. And the goal is really to get dogs back to normal.
Right.
Whatever activity that they, hiking, agility, whatever, we're trying to get them back to that. But probably the biggest complication would be infection. Anytime that you have a surgery that has an implant, if a bacteria gets onto that implant, then it is very difficult to eradicate that infection with antibiotics alone.
And that's kind of what happened with Maya.
Yeah,
right?
this is a problem in people as well. So bacteria can produce this mucus film called a glycocalyx. And what this is it's basically the bacteria, it's almost a protective coating on the bacteria. And so they can live on a plate like this, have a little kind of mucousy coating. So antibiotics can help to take down the signs of the infection, but it truly doesn't eradicate it. So maybe several months, maybe 6 months, sometimes maybe even a year later, you might start to see a little bit of drainage, a little bit of swelling in that area. And so that happens, if you look at the literature, usually anywhere between 5% and 15% of TPLOs. At our hospital, the rate tends to be somewhere around 5%, so on the lower edge of things.
Right.
But when you do get an infection, eventually, once this bone heals in position, the plate and the screws are not needed anymore.
So this actually does a full healing just like this.
Absolutely.
It's one unit again.
Yes.
Okay.
So that takes a total of about 3 months to really get complete healing.
That's it.
Yeah. So now after about, usually after surgery, we restrict activity for about 6 weeks.
Right.
But at that point, there's been enough healing that dogs can start to gradually perform activity without worries that they're going to break anything down.
Right.
However, in terms of complete healing of the bone, that usually takes about 3 months.
Okay.
So anytime after 3 months, once that bone is completely healed, the plate and the screws can be removed without affecting the surgery at all.
I'm a
because the
testament
knee
to
is, the knee is still stable, the tibia is still in its new position, and the plate and the screws are not needed. So,
Amazing.
5% of the time when dogs get infection, we do end up removing the plate and the screws down the road.
What's the plate made out of?
This is surgical grade stainless steel.
Stainless steel. Okay.
Yeah, there have been, some companies have done titanium and even some bioceramics that people are doing in terms of that absorb over time. But, those tend to be more expensive with, let's say any kind of minimal advantage.
Right.
So in terms of trying to keep the cost down for the consumer, for the client, we still go with the surgical grade stainless steel.
Yeah, like I said, it's amazing. And is it one unit that fits on every dog?
That's a great question. We actually have many different size plates.
Oh.
It goes from a plate that's about that big that you can actually put in a cat to a bigger plate that I'll use in big Mastiffs and Great Danes.
Okay. Yeah, and I sent you somebody, I forget, one of my clients actually had it done, and everybody has been so happy about the results of this surgery. I think it's just amazing. You were saying something like certain activities that might lend itself more to these type of injuries, like what you're saying is this hyperextension that really does it, right? And that's when I can see now, looking at the model, that when it's that extension, that's when that is really at its most vulnerable position.
Yeah, exactly. Right? Yeah, when it's flexed like this, the ACL is actually not even taut.
Right.
And then as we kind of have it more in extension, that ACL becomes more taut. So if there's anything that kind of shifts that tibia forward instantly, in football, obviously a lot of linebackers get their knee run over, and skiers, again, they plant, and then that leg just kind of goes forward, and that's what's going to tear the ACL.
Now, so certain sports, like Janet does agility with her dogs, I'm always looking at that, and I always thought it was the twisting action that would have more of an effect on it. Does it lend itself
Absolutely,
to that?
yeah, that is the other thing, is because, again, the ACL or the CCL resists internal rotation of the tibia as well. So anything where they plant and twist that also can cause tears of the ACL.
Okay, we were talking about, I'm against dog racing personally, but racing is another thing that probably lends itself to it. You mentioned the greyhound.
Yeah, interestingly enough, greyhounds do not tend to have very many cruciate ligament injuries, and they're, in fact, oftentimes they're studied as the antithesis to dogs with CCL injuries, such as Labradors, and I'm not really sure why that is.
Interesting.
But greyhounds, you would think that in a racing where they're running around a track, they would lend itself, but they actually have a lot more problems with various bone chips in their, or ligamentous injuries actually lower down in the leg. So in their tarsus and their carpus, if they plant the wrong way when they're running, then it leads to various actual chip fractures in their wrist or their ankle.
In their ankles, okay.
Yeah.
Good. So there's other injuries that can happen in the leg as well, right? And one of the ones that I wanted to touch on was meniscus injuries.
Yeah, so this actually goes along with the cruciate ligament injuries that we've been talking about. Now, in people, a lot of times, again, this tends to be a traumatic injury, football, skiing, soccer, some kind of a traumatic injury to the knee.
Badminton.
Or badminton, this could be, or martial arts, and contact or non-contact sports. And so people can actually get primary meniscal injuries.
Okay.
In dogs, that's incredibly rare. Wow. What happens is that when a dog tears its cruciate ligament, its cranial cruciate ligament, again, as we discussed, that leads to instability within the knee. Right. Well, if you take a look, here, this is the meniscus in the knee. Well, if this is the tibia and the femur, and this is where it sits, if now that tibia can shift forward, well, look what happens. Now that meniscus is in a really bad position because the femur is contacting parts of it that it normally doesn't. So we can actually get secondary meniscal tears because of the instability within the knee. So when we go in surgically, one of the things that we assess is there a tear of the meniscus? Because that can actually be a source of pain, because the meniscus is a piece of cartilage that can fold up, and if the femur is pushing on that or impinging it, that is a source of pain. So actually a lot of dogs will tear their cruciate ligament and kind of get along okay on the leg, and people kind of like, oh, okay, my dog's a little sore, but overall doing okay. Then they tear their meniscus, and now they're not using the leg, they're painful, and that's usually a lot of times when I see the dog. Now, when I go in surgically, whether a dog has a torn meniscus or not really doesn't affect the long-term outcome. The problem is that if they do have a tear and it's not addressed, that can lead to ongoing pain. Okay. So when they have a torn meniscus, what we do is, a lot of times I get asked, do you repair it? But the problem is it's a crushing type of injury, usually to the meniscus. So what we actually do is take out the torn portion of meniscus, and then over time, you get, basically, it's not as good as the original meniscus, but you do get cartilage that fills back in that area to provide some cushion. So in the long term, whether the dogs have a torn meniscus or not, does not necessarily lead to any further deterioration or any problem. It's just a problem if you don't address if there's a torn meniscus.
Interesting. So if you have a CCL tear and you don't address it, it can down the line make it much, much worse.
Well, if for whatever reason it was missed or not addressed at the time of surgery, then the dogs may not recover as you would expect from a knee surgery because the torn meniscus is an ongoing source of pain. So I do tend to see a torn meniscus in about 50% of the dogs at the time of surgery for the knee.
Interesting. Now, I'm noticing there's some little stitches down at the bottom there. Oh. Did you do those?
No.
Because how do you? Is that part of surgery school? Like they teach you how to sew like that? Is that a class that you get?
Oh yeah. In school, they teach you all kinds of different suture patterns. Wow. You're practicing on little pillows and chicken skin and whatever you can practice. And I remember having a needle and suture at home, practicing all the time.
I used to sew. Yeah. I mean, it might be a new revelation for people, but I did used to sew. I sewed shirts and jackets and stuff like that. But like the sutures and everything that you did were almost like a plastic surgeon. I mean, there's no sign on Maya that it was so beautifully done. But what I want to touch on is this. Everybody said to me, they said, "Oh, don't do that. Try, ultralight, violet light therapy and burn candles and then, chant and, all these crazy nutty things." And I believe in a lot of Eastern things with my martial arts background, but I really believe in Western conventional medicine. I think, as a society, we've evolved and we really have the most amazing medicine available to us, as well as at your hospital, which I want to talk about in a second. But one thing that people, it's a biggest scare factor for people, and it's the recovery. Right. So what does that recovery look like from day one to 6 months later?
Yeah. I mean, this is, people are so nervous that, they're going to screw something up.
Yeah.
And, again, everyone can go through this. And whether it's an active dog or not active dog, and again, the internet propagates certain myths. But, basically what the recovery process looks like is, again, these dogs at our hospital spend the night. They go home the following day. There's no bandage, no cast on the leg, just an incision along the knee. So I usually do recommend that dogs wear an Elizabethan collar or some equivalent, such as the donut around the neck, in order to prevent them from licking at that incision. And again, the reason is because there's natural bacteria within the mouth,
right.
And when dogs lick, you're introducing bacteria to the incision, which again can lead to infection, which can lead to the necessity of plate removal down the road. So for 2 weeks, I have dogs wear an e-collar to prevent licking at the incision.
E-collar being a cone head collar, not an electric collar.
Yeah, exactly. Some people think their satellite TV gets picked up better, but
you can feed them faster. You pour the food in the cone. Don't do that.
Yeah, I mean, no one likes the cone, but
right.
But it is a necessity for a couple weeks.
Yeah.
And a lot of times dogs will start kind of touching down that leg within a few days of surgery, and I'm fine with that. As long as it's in a controlled manner.
Right.
So for 6 weeks, I usually recommend basically just leash walks to go to the bathroom.
Yep.
So it's okay if it's 5 minutes, 10 minutes, a block or two,
right.
Whatever is necessary to go to the bathroom is fine, as long as it's on leash. So I prefer, not to have dogs loose in a yard where if they see a bird or a squirrel or get excited, and they run around.
Right.
I just want them under control.
Yep.
Inside the house, during the 6 weeks, again, basically I recommend just maybe one area of the house. They don't have to be in a crate if they're not used to it. If they are, that's great.
Yeah.
In terms of stairs, just as necessary.
Right.
You don't have to carry your dog up and down the stairs.
I did.
But usually then I worry more about you're going to have an injury.
Yeah, you should.
So they can go up and down the stairs. I just say, go slow and do it only as necessary.
But slippery floors?
Well, again, the part of the problem in Los Angeles is everyone has hardwood floors.
Right, like I do.
So, if it's truly a problem, I say people can put down little runners or something to give a little bit. But again, as long as no throwing of toys, no roughhousing with the other dogs in the house. And if you can kind of prevent that, these dogs are going to be okay.
Yeah.
They're going to be fine. It takes, quite a bit of trauma to screw this surgery up, basically. So, there's often a little bit of swelling of the leg after surgery, but that resolves within a few days to a week. They're on some anti-inflammatories, some pain medications, sometimes some antibiotics for a few days. We usually take the stitches out a couple weeks after surgery. And then I take an x-ray 6 weeks after surgery. And the point of that x-ray is really just to assess that we have enough healing that now we can start to gradually increase that activity, again, without worry that the dog is going to screw anything up. Right. And it gives me confidence as the surgeon. It gives the owner confidence. And, again, a lot of people come in and tell me even at 2 weeks that, they think that, oh, maybe the dog will just kind of restrict their own activity, because they know they're hurt. And I said, no, and usually by the time the clients come in at 2 weeks, they're like, yeah, you're right. My dog wants to run. And I'm like, yes, they feel good.
For sure.
And obviously they walk around on 3 legs after surgery. They kind of hold that leg up right after surgery. And they start to touch it down pretty quickly. And then after that 6-week x-ray, usually I recommend about 4 to 6 weeks of just kind of gradually getting back to normal activity. So maybe just, again, starting with some longer leash walks and then, gradually working to a little bit of, maybe some running on leash and then gradually working again back up to a little bit of running off leash and then eventually back to full play. So the goal is that usually within about 3, maybe 4 months, depending on the dog, they are back to running, hiking, playing, catching a Frisbee on the beach, especially here in LA.
Yeah, right.
Whatever they enjoy doing, that's my goal, is to get them back
3 to 4 months.
That's, exactly.
Because I noticed it with my, exactly like what you're talking about. It was a full recovery. It's amazing. But one of the things I was told about, and you mentioned as well, is that there's a very high likelihood that the other one could be affected, her other leg.
Yeah, if you take a look at the statistics, it's right around 50%. And again, a lot of times that's because we've got the same conformation, we've got the same forces acting in both legs of a dog. And again, because it doesn't tend to be a traumatic injury, it tends to be just kind of this ongoing stress on the ligament that eventually it tears. So, you have to figure, well, if a torn one knee, it may tear in the other knee. So I usually tell people, maybe in the next 6 to 12 months is maybe a problem. Sometimes it doesn't. Again, if it does tend to be more of a traumatic injury, if the dog is doing agility and runs and hits the ground wrong or something, then maybe the other side will be okay. But it is something obviously to keep an eye out for.
Just start saving your money. You're going to do the second one. But it was so worth it.
Yeah, it is. And a lot of people actually ask me about insurance.
Yeah, I have insurance,
which is great.
I was covered.
Yeah, and that's and it's important. But because this is such a common problem, and so many people now have experienced this, and maybe in one leg of their dog or in another dog, a lot of insurance companies tend to necessitate that you have their coverage for a year, sometimes longer, before they will cover this injury. So a lot of people think, okay, hey, if they tore the ligament in one knee, and then I pick up some insurance, it may cover the other side. It may or may not. And I think, every insurance company is a little bit different. You have to take a look at what exclusions there are and riders specifically for this injury.
For sure.
So it is something I usually certainly recommend getting when they're younger versus waiting for an injury.
For sure. Do you see the injury at any certain age? Like, have you seen it with young dogs or older dogs?
Yeah, it's interesting because I tend to see it a little bit slightly different age for different breed dogs. So the Labrador, for example, I tend to see right around 5 years of age. It just seems like that's about when they have a problem. Versus these bullies, these pit bulls, American bulldogs, I actually tend to see at a much younger age.
Wow.
I have seen lots of these dogs come in with actually 2 bad knees. Both of their knees are bad already by the time they're 2 years old.
Wow.
So at a much younger age, sometimes even between a year and 2 years.
Wow, that's terrible.
So very early on in life, we're fixing both knees in these dogs.
What do you do? Because I know he's on 3 legs, but what happens if they have both knees bad? Do you determine which one's worse, or what do you do?
Yeah, it's I tend to, because the problem is if you do both knees at the same time, and there are certainly surgeons out there who argue that that's what they do. I personally don't do that because I think it is a very difficult recovery when you do surgery on both legs at the same time. The other problem is that you necessitate a very early usage of that leg, and you're going to increase the chance of a complication. And so what my preference is to find out which leg tends to bother the dog more, fix that, and then I usually come back about 1 month later.
Oh, within a month?
Within about a month, yeah. I usually find somewhere between about 1 to 2 months after surgery, they actually start bearing more weight on the operated leg as opposed to the non-operated.
Wow.
And usually, anytime after that, I'm fine doing surgery on the second side because they're already bearing more weight on the operated side. So I'm fine, again, taking that weight off of the other side. Wow. So we usually will space it about a month to 2 months apart.
Wow. I mean, it's such a life. I can't tell you enough good things about this surgery, and I'm not a big believer in doing surgery and doing this stuff. And you even mentioned that even an older dog, like if you had a 12-year-old dog, you would even recommend it at that age.
Yeah, I've done this. I want to say the oldest dog I've done this on is maybe 14.
Wow.
But you know, the problem is age isn't a disease. You know,
Right.
and if I had a crystal ball and knew how long these dogs would live, it would certainly make these decisions easier.
Yeah.
But at 12 years old, if I have a healthy, you know, golden retriever who, you know, could live another 3-4 years, I don't know, you know, then it's worth fixing, you know, the knee. And again, to me, I kind of make the joke, you know, if my, you know, 90-year-old grandmother, you know, broke her hip, you know, we'll fix it.
Yeah, we wouldn't put her down.
Yeah, you know, because who knows how long, and you want to make them comfortable. And
Yeah.
again, you know, it's something to think about, but they're still very successful in terms of the recovery.
That's the important part, because it gives them a better quality of life.
Absolutely. I mean, I'm still, you know, at 12, I have lots of dogs out there who are running around.
That's awesome.
You know, like they're young.
Yeah,
and so if I can get them back to that, great.
I think that the quote of the day is age is not a disease.
Absolutely.
I love that.
And it's, you know, to me, I see a lot, you know, I mean, you could be very unhealthy at 8 years old versus 12 years old. So if I obviously I take a look at the dogs, you know, in the whole and in the entirety. And if the organs are working well, if the heart is working well, if, you know, the amount of arthritis is minimal and they're getting around okay, then let's fix it.
I love that. You're very passionate about dogs. I saw the way you were with Maya. I see when you talk about your dog and all this stuff. What drew you into becoming a vet? Like, were you working as like a taxi driver and said, I got to be a vet? Or like, what
well, it's actually, you know, it's funny. I you know, because I meet so many young people who, you know, get interested in this. But, you know, I actually, when I was about, I want to say I was in 2nd grade, and I lived in the suburbs of Chicago, and we had cats, several cats at the time, and I distinctly remember they were kind of indoor, outdoor cats, and coming home one day from running an errand with my parents, and our cat had been hit by a car. And, you know, you come home to find that on the street, and it affected me, you know, at that point, at that age. And ever since about the 2nd grade, I knew that that's what I wanted to be, was to be a veterinarian. Now, in terms of becoming a surgeon, that was something that growing up, there was very little specialty, you know, in the field. So even as I was just getting into veterinary school, specialties were just starting to become a thing.
Really? Wow.
So as I started to go through school and realized that this was a possibility, in school, they teach you to do certain surgery and, you know, you get experience, obviously, with certain rotations. And, you know, I've always been someone who likes to fix something and that, you know, that gratification of it and you know, working, you know, with my hands and thinking things through on the fly. And I just naturally was drawn to surgery. And basically, as soon as I started taking some getting some surgical experience and getting surgical classes, I knew that was the road I was going to go down.
Yeah, it's a guy thing, right? We want to fix it.
Well,
there's some amazing female surgeons too.
Yes, exactly. I was going to say,
you want to get a hashtag Me Too or something like that.
Yeah, I mean, in my experience, actually, I've met some unbelievable, great female surgeons that I only wish that I could be as good as.
Right. Well, it's not a sexual thing one way or the other, but I agree with you. I think it's just a guy, like, we grew up tinkering, and I used to always take apart my mom's watches and stuff like that. Yeah. Did you ever do stuff like that?
Yeah, absolutely. And that's, you know, I feel like that's why I've gravitated towards orthopedic surgery is, you know, the idea of, you know, with fractures or you know, ligament problems and, you know, the creativity of each one is a little bit different, and being able to go in there and put things back together and figure out the best way to repair it. You know, I certainly do a fair amount of soft tissue surgery and even neurologic surgery as well. But I tend to gravitate towards the orthopedics because just to me, it's just a great thing to see when a dog is having trouble walking or, you know, not using a leg, and being able to get them back to doing what they need to do.
And not only making it as good as before, but this surgery actually makes it better. You're actually improving on the...
Yeah, that's funny. I mean, because I have so many clients who, again, they don't even realize that their dog has torn ligaments, and sometimes, again, in both knees. They just think their dog just doesn't like to do a bunch of activity and is slowing down and whatever. And we'll fix up both of the knees, and I cannot tell you how often they're like, oh my God, my dog is like a puppy again.
Yeah, so
you know,
awesome.
The dog wants to run and play. And I go, yeah, you just don't necessarily, especially when both legs are affected, you just don't realize that, how much it affects them. And it's not that they're slowing down. They're just
Right.
sore.
Yeah, that you need to help them with that. So I know you said that the CCL is probably the number one injury you see in orthopedics.
Sure.
What are some of the other ones you see? What are let's say the 3 most common besides CCL?
Yeah, well, other than kind of traumatic fractures,
Right.
and certainly out of the shelters, and there's a lot of dogs running
Sure.
around who get hit. I see still a lot of what's called elbow dysplasia.
Okay.
And elbow dysplasia is where basically the elbow is incongruent, and that can lead to various fragmentation or irregularities within parts of the elbow joint that can lead to lameness. There's definitely a genetic component to elbow dysplasia, just like a lot of people are very familiar with the term hip dysplasia.
For sure.
That was something that was worked on very hard, with breeders during the basically 80s and 90s, because it was so prevalent. And I see much less hip dysplasia now than I used to when I started out as a surgeon.
That's good to know.
But elbow dysplasia is a little more tricky because sometimes 30% of the time X-rays are normal. So you don't necessarily, whereas hip dysplasia can always kind of be shown on an X-ray.
Right.
Elbow dysplasia is something that can sometimes be a little more subtle. Now I can pick that up on a CAT scan, but not necessarily on an X-ray. So I would say that probably when I have a dog limping on a front leg, and obviously the cruciate ligament is in the back legs and the knees. There's no cruciate ligaments in the front legs. A lot of people ask me that,
question.
but no, they're just elbows in the front legs of the dogs. And when I see a limp in the front leg, I would say that is probably by far the most common thing that I see is elbow dysplasia causing irregularities within the elbow joint.
So that's a great thing because dogs have 4 legs, but they're not really 4 legs because you're calling it an elbow on the front, so it's kind of like you're walking on their hands and feet.
Exactly. So basically if you just got down on all 4, that's essentially their anatomy.
That's interesting. That's really, because that's a great point. They don't have the CCL in the front.
Yeah, no, not at all. So if a lot of people worry once I fix that second knee, then now I'm going to have to go to the front legs.
You're
that's
good.
Not a problem. I also do see certain, other common problems. I certainly still do see hip arthritis, secondary to hip dysplasia. I feel like even though it's not as prevalent as it used to be, it still is out there. Still a lot of breeding of dogs that, lead to bad hips, a lot of overbreeding of, certain breed dogs.
For sure.
So that's something that as they get older, we have to deal with the arthritic changes within the hip, sometimes, with medication, sometimes with surgery.
Wow.
Really depends on kind of what's happening with them.
What about the back? Like the back is such a big thing with dogs, especially in sports. It's that torsion in the back. Do you see any back injuries that are common?
We don't tend to have the same kind of back injuries in dogs that we do in people. And part of that is because of, again, their horizontal nature to their vertebrae and to their spine, as opposed to our vertical nature to the spine.
Of it.
So, when we are kind of standing upright and vertical, we have a lot of problems with collapse of our vertebrae, and instability, which can lead to, for example, changes in the lower back and sciatica. And that'd probably be the most common thing that, they tend to see in people. Certainly there could be issues with herniated discs, but a lot of our problem is collapse and instability. In dogs, you can see that, but it's much more rare. Again, because they're horizontal, collapse is not really an issue.
Interesting.
So you can get some instability. German Shepherds is a very typical dog who has instability at their lumbosacral junction. So, for example, a lot of working German Shepherds, police dogs, military dogs, that is a big problem where they have instability at their lumbosacral area, and that leads to kind of like a sciatica for them, some pinching of the nerve roots. We also have some instability problems. For example, Wobbler's disease is in Dobermans and Mastiffs. They have instability of their cervical spine, and that can lead to changes that causes pressure on the spinal cord and the neck.
Okay.
But the most common back problem we tend to see is herniated discs. And part of that is because we have what's called chondrodystrophic dogs. So what chondrodystrophic is any dog that kind of has this kind of abnormal cartilage, abnormal bones and cartilage. So for example, the typical is a dachshund.
I was going to ask you about dachshunds.
Dachshunds, corgis, I see a lot of French bulldogs.
Yep.
And their cartilage, they tend to get degeneration of that cartilage at a very early age.
Okay.
Again, usually around 4 or 5 years of age.
Wow.
And when that disc between the vertebrae becomes degenerative, all it takes is a little bit of force and that disc can herniate. Jumping off a couch, again, off a curb, anything. And when that disc herniates, that puts pressure on the spinal cord, and that can cause instant paralysis in the hind legs.
Wow. And it's common in those breeds because it's genetic or because of the shape, the conformation of the dog?
Yeah, it's yes. I mean,
both?
But that's what, when you have dogs with those tiny little legs, that's what's called chondrodystrophism.
Got it.
And those are the dogs that tend to have irregular discs.
So the ratio of the leg to the spine. So looking at a dog like the old German Shepherds or the Belgian Malinois, for that, where you're really breeding for this evenness, is a better thing orthopedically for the dog, you think?
Yeah, I'm not sure if anyone's actually looked at that. It's a great question. I think that certainly, having a synchronous body, and I think that's always a good thing, because you're going to have various stresses, and abnormalities. And that's why, again, everyone says get a mutt.
Yeah, for sure.
Which, I understand. But I also understand there's a certain advantage to getting a certain breed of dog because, they have certain characteristics that are utilized by a lot of people, and it's very predictable versus a mutt that isn't.
Right.
But you also breed in certain characteristics that can lead to problems.
Yeah.
So, for example, the dachshund, for example, the German Shepherd, with instability in their lumbar spine. So, it's kind of a mixed bag there.
Yeah, it is. I mean, I would say if you want to get a dog, get a dog. But, I love breeder dogs. I think breeders are a huge piece of keeping certain lines going, breeding out certain characteristics, breeding in certain things, and looking at it. And of course, like with anything, there's good and the bad, right?
Yep.
So you've got great breeders, and you've got really poor breeders.
Yep.
But somebody who's really taking this to heart, who's trying to breed, they find, like we were talking about the dysplasia, that there's less because they're not breeding these dogs with dysplastic tendencies.
Yeah, a lot of, I feel like a lot of veterinarians tend to be very anti kind of breeding, and which I understand. There's a lot of dogs that need to be rescued, especially here in a city like Los Angeles. Course, and so, why not rescue those dogs as opposed to breeding more, dogs in when there's so many that need to be rescued. However, that being said, I agree with you that I totally understand, the advantage of having a bred dog, as long as it's a responsible breeding.
Yeah.
And that is definitely an uphill battle that I fight.
Trust me, me too.
Is that to me, the biggest reason to breed a dog is to make that breed better. And if you find genetic conditions in that dog, such as elbow dysplasia, such as hip dysplasia, then if you breed those dogs, there's no way for you to tell me that you're making that breed better because you are keeping that problem more common in there. And unfortunately, trying to get breeders who will stop breeding certain dogs when genetic conditions come along is very difficult.
Yeah, I mean, I give them shit all the time. I mean, that's such a huge issue with it. And if you see my podcast, I call a spade a spade.
Yeah.
And somebody's doing that's horrible. You know? And there's a lot of bad rescue groups and bad stuff. But, somebody's breeding, they really need to look at, and what I always talk about is temperament of the dog. And you can see aggression can start at you can see it in an 8-week-old puppy. The dog is just a bad seed. And as much as I hate putting dogs down, I would say, you've got to cull that one or at least neuter it so it's not going further, because the more of this negative, whether it's physiological or behavioral, it's gonna make the pool worse and worse and worse.
Yeah, I mean, there's a responsibility.
Yeah.
If you're going to breed a dog and you want to make that breed, you can't just rely on looks or conformation or temperament. I mean, it's all of it.
All of it.
And if you're putting something into a breed that is not good for that breed of dog, then stop breeding it.
For sure. I wish people would listen to that. All right, so continuing our conversation, this is just one of the best interviews. I mean, I just love all the...
Thanks.
Your vibe and everything is really cool, and I think that's... I know when I first met you and you were going to do myosurgery, I got a great vibe from you. You're a good guy. I think you really care about obviously what you do. And we're talking about dogs and stuff. So I know you have a dog. One dog?
At the moment, one dog,
okay,
yes.
So tell me about your dog. I think it's so important.
Yeah, right now I have Marina. She is a little, about a 40-pound kind of husky, maybe Shiba Inu mix.
Okay.
I don't know. I'm not a big fan of the DNA testing.
Okay.
I just kind of like calling her whatever she is.
She's a dog.
She's a dog. And we got her from a great rescue group in Los Angeles, Lang Foundation.
Okay.
And, basically I had a Labrador and a Shepherd mix who had both gotten older together and passed away. Wow. And I was just ready for a puppy and saw this dog, and she is... just loves life. I got her when she was about 3 months old, and one of the things she just loves is running on the beach. She just goes crazy. So I hope there's no, Los Angeles Pacific Division listening to this, cops, but they're not really allowed to have them on the beach. But, we like to go early in the morning.
Good.
And, a lot of dogs will kind of run around, and she just goes running into the waves. That's awesome. And just running through, and you just see how happy she is when we do that. So, my wife and I try and take her out there at least once a week, awesome. to kind of before everyone gets out there, to run through the waves.
That's an important part too, because you say, everybody knows I hate dog parks. I'm against all these off-running, loose-running dogs. But you're making a really good point. So you're taking your dog to an area of the beach where and people that you see all the time are there. It's not like you're in some strange park and some crazy dog, and I'm not going to say any breeds, but they run up and bite your dog. Yeah. This is a controlled environment. You're obviously...
Well, it's interesting because I completely agree with you, and I am not a fan of dog parks. And I completely trust my dog.
Right.
I absolutely do not trust the other dogs at a dog park.
Right.
And the interesting thing is that dog parks are confined.
Yep.
There's a confined area, and the beach, I find not only do I tend to know, the dogs in our neighborhood, sometimes I don't, obviously there's people who come in, but when it's more of an open area, they don't tend to be as territorial, and dogs can kind of run away and get away from each other. And I have, again, knock on wood, I've never had any kind of a problem, with dogs or dog fights. I'm sure it happens there, but just I have not experienced it. Much more common to happen in a dog park.
For sure, for the confinement and the territorial thing. Yep. And how old is
so
Marina?
Marina is now about coming on 3 years old.
Okay, and does she sleep in bed with you guys?
Well, if I'm out of town, then she'll sleep with my wife. But
okay. What if your wife's out of town? Does she sleep with you?
No, she doesn't. She tends to. She'll come up and hang out, but she'll very quickly jump down.
Really?
No. So she has a little dog bed right next to our bed that she sleeps.
Okay. My dogs sleep in bed.
It's fine. Again, our dog is in bed with us all the time, but it's actually her. I think when we move around, she prefers to sleep in her dog bed.
Yeah. Goofy's like, if you move around to Maya, especially, like Maya's on the bed, and if you make any movement, she's like, okay, I'm out of here. Where Goofy kind of does it, and then Jimmy, our black lab, you could like be having an epileptic fit in it. I don't mean that politically incorrectly, but you could have like a crazy fit in the bed, and he'll stay. He's like, and he's a blob. He just gets bigger. By the end of the night, he's like 260 pounds.
Yeah, that's awesome. Yeah, no, Marina loves sitting on the couch with us. Hanging out while we're watching TV or something. But just at night, if we just start, she's like, nope, I'm going to my dog bed. That's where I want to sleep.
And she's like, she loves all people and everything.
Yeah, she's, she just, she does tend to be a little bit protective of her territory. For sure. Which, I'm okay with, after just a couple minutes of someone coming in and she realizes it's fine, she would never attack or anything.
Right.
She's very shy.
Right.
But I don't mind her barking if someone comes up the stairs.
Oh, you want that?
And but then she just loves affection, and she's definitely one of the most affectionate dogs I've ever had.
Wow.
And it's just amazing. And we also have 2 cats.
Oh, okay. That's
both
good.
Young. One is about 2, one's about 1.
Wow.
And she loves the cats, and I often will find the 3 of the 2 cats and the dog all sitting together on the couch. And,
that's awesome.
Yeah. So I can't ask for anything more. She's a great dog.
How did you acclimate them together? Because I always get people ask me questions. How do you get dogs and cats to get along? And my thing is, it's really up to them.
Yeah, I mean, it's I feel like having them all young.
Desiree smiled when I said that.
my wife's watching this.
Yeah.
So having them young, I think helps. When you don't have necessarily established territory, and Marina was about a little over a year old when we got our cat June, also rescued, and she had a fracture that I fixed up and then brought her home, and basically just kind of let them. I saw how she was, with the cat, and as soon as I realized, that she was fine, there's no danger, just kind of let them acclimate, and the fact that she was a kitten and Marina was young, they just kind of grew up together, and then same thing now when we brought in our newer kitten Wrigley, that. Again, he was not scared of anything.
Oh, wow.
And, loved the dog from the day we brought him home. So and, they just now all just kind of, they often will eat out of the food bowl together.
I was going to say, I bet you the dog eats the cat food.
Well, she would if she could.
They love that's one of the things we used to use for training things in IPO. We put cat food out.
That's amazing. Yeah, we have to put the cat foods up on the counter. Otherwise, otherwise we'd come home and be like, why are our cats so hungry?
Yeah.
And
do you have
really
those cat
Marina.
Condominiums, like those big, or not the condominiums, but the big trees and stuff?
Well, we have like posts where they can sleep, where they're they can get away from and each other.
Yeah, I think that's a huge piece too. One of the things that if the cat has a way to get away from the dog, then the dog understands it, and cats are so smart.
Yeah.
Right? I mean, dogs do things we want them to do, and cats don't do anything we want them to do because they know they don't have to.
Yeah, exactly.
But that's really great. So one thing I want to kind of talk about in closing, and that is this amazing hospital where you work. And I've been there for little emergencies and big emergencies and goofy. I'm not going to talk about that right now. Has been there. Maya has been there, and it's called ASEC, Animal Specialty Emergency Center.
Yep.
It's in West Los Angeles. Tell me a little bit about it.
Well, it's so we used to be a surgical department kind of down the street, and we started. A group of us surgeons started ASEC, and gosh, now about 17, 18 years ago, and slowly added in specialists to our hospital. So now we have internal medicine specialists, we have cardiologists who you've had some experience with, we have radiologists, we have oncologists for cancer, and we have criticalists. So basically we have, currently we have about 35 doctors at our hospital.
Wow.
We are purely a referral hospital, so we do not do any general practice, other than people who walk in on emergency. All of our cases are referred from general practitioners. So we have a very close relationship with a lot of the veterinarians in the Los Angeles area where, basically once a situation gets a little bit, out of their comfort zone, that's when they refer to one of our specialists. And then, we do everything we can to fix the problem and get them back to their regular veterinarian.
Yeah.
So it's actually really a team effort.
Yeah.
There's nothing that I do as a surgeon that I could do without my referring veterinarians as well, and it's something that there's a lot of communication and the aftercare and ongoing care that we really work with them as well, with the client and the animal. Yeah,
you guys have an impeccable reputation, and that's very hard for me to say, but it's impeccable because there's so few hospitals that have that, because a lot of it is, and I'm not slamming all that, but it's an upsell. It's like you do this, oh, you should do this, oh, you should do that. Where with you guys, it's really, every time I've been to you guys, I've paid the fee, the quote, and every time I've gotten like a refund of like $40. I'm like, who cares about the $40? But you guys are really an ethical organization.
Yeah, thank you. It's one of the things that we actually pride ourselves on is that, first of all, and as a surgeon, I can't speak to, any of the other specialists, but my goal is to actually not do surgery.
Right.
If there is a way that I can avoid doing surgery and get the animal better, then great.
Right.
So what I always say is, just because I see a problem doesn't mean you need to fix a problem. If I had to fix every problem I had, I'd be at surgeons all the time.
Right, me too.
Knee hurt, back hurt, whatever.
Yeah.
So really it comes down to, a quality of life issue. If I can do a surgery to improve the quality of life of that dog, now there's benefit to it. If there is no benefit, and I can't, or I can achieve the same results with medication or rest or some other alternative therapy, then I'll do that, and so I feel like that honesty really resonates with people, because there's never a situation where I am going to be pushing surgery. You know, I will absolutely give my opinion and, you know, guide, but, you know, it basically has to do with communication, and the clients realize that, this is, if I'm recommending it, it is in that animal's best interest.
So is ASEC owned and run by the surgeons?
It used to be, and we actually got taken over by VCA, Veterinary Centers of America, about 4 years ago now.
What is VCA? Is that
so VCA is a large, you know, the corporate veterinary medicine has become more common, you know, over the last 10 to 20 years. And VCA has been around now for a long time. They've had a flagship hospital in Los Angeles. And so we've known the owners, we've known that company for a long time. And basically what VCA is a kind of a consolidation of animal hospitals that are, you know, improved through the size, basically, you know, kind of, you know, being able to give care more affordable because of, you know, vendors and you know, management of supplies that can be done in a larger size versus the little boutique animal hospital that we used to be. That being said, after we were bought by VCA, nothing changed within the service of our hospital. There was nothing that was dictated. There was nothing, you know, price-wise. I mean, we still basically run our hospital as we always had, you know, and still providing that same level of care of, you know, as a smaller boutique, you know, as we like to call it, you know, specialty hospital, even though now we're technically corporate owned, and VCA recently was bought by Mars. Oh my God. So, you know, who also owns, you know, Pet Foods and Banfield and, you know, lots of,
Love M&Ms.
And M&Ms. I know, I always ask, where's our candy? Why don't we have candy?
They don't give you candy?
No, I've never seen one thing of candy from Mars.
That's I don't think they own it.
So yeah, I mean, we're you know, now owned technically, you know, by one of the largest companies in the world. But again, it hasn't affected our service whatsoever.
You're a small team of surgeons start. So that's what I love about it. So you're so passionate about this. You start this company, and what a great American dream. I mean, you're in second grade, you want to do this, and now you're one of the top in the country.
Yeah, I mean, well, thank you. But I mean, there's so many good surgeons, so I take that as a compliment. But, you know, I mean, you know, and certainly, you know, Dr. Lippincott was the original surgeon who founded our hospital, who was one of just the most amazing guys I've ever met, one of the most amazing surgeons I'd ever met, had just a calm and a presence about him that taught me so much about becoming a surgeon. And, you know, and then Dr. Anderson and Dr. Gill, you know, came in and then basically took over that surgical practice after Dr. Lippincott retired. And then I was fortunate enough, you know, with Dr. Somerville, one of the other surgeons, you know, to be brought into that group, who then, you know, helped to establish ASEC. So I definitely was not, you know, the original, you know, part of that, but, you know, definitely helped to turn our little surgical practice into a, you know, kind of a multi-specialty referral hospital. And
so at ASEC, which is in West LA, I'm sure you get people all over the country who fly in to see you guys.
Well, I mean, yeah, I mean, we, you know, I'd say obviously the vast majority of our clientele is, you know, in Southern California, you know, coming from, you know, again, from Malibu or Palm Springs and even Southern, you know, even south of here, even San Diego, you know, Peter, San Francisco, you know, people come in. You know, certainly not as many that fly. I mean, there's a lot of people who have various houses in various parts of the country who maybe have a residence in LA. But, you know, every once in a while.
But it's the one place that, if you know, and it's so hard to find. I was based on where I live. Is there an emergency hospital nearby? Because 24 hours a day, you drive in there, and it's not like, oh, we got to call the vet. He's, you know, at the casino. There's somebody actually there who's going to do something.
Well, and again, as a surgeon, you know, I need criticalists and doctors, you know, they're overnight who are watching my patients, you know, whether it be, you know, anything from, you know, just making sure that they're comfortable, and that, you know, they're getting the right amount of, you know, pain medication, you know, just to assess them, or if anything goes wrong, you know, that could be addressed in the middle of the night. So, you know, it's just a, you know, not only, you know, that, but, you know, to obviously to be available for anyone that has an emergency. So yeah, we're open 24/7. every day of the year.
Yeah, and it was funny. Steve Wright had this joke. He said, the store said open 24 hours a day, and I went in, it was closed, and he said, well, I thought you guys were open 24 hours a day. He said, well, not in a row. So
nope.
You guys are open 24/7 in a row.
There's never a day that we don't have doctors there.
So you do a lot of specialty surgeries. How many surgeries will you do in a day?
So, I personally see appointments in the morning and then do surgery the rest of the day. A lot of animal hospitals, surgeons, kind of like to have receiving days and cutting days. I prefer, especially in LA, because people come from so far away, to try to accommodate them by doing the surgeries the same day if at all possible.
Right.
So I usually will see appointments in the morning, and I will do anywhere usually between 2 and 5 major surgeries or procedures in the afternoon of a day.
And how long does a surgery take, like doing this TPLO? How long does that?
TPLOs that I've now done thousands of. It takes less than an hour.
Really?
But it can take anywhere between half an hour to on a smaller dog, more simple procedure, to if I'm doing a complicated pelvic fracture, for say, that could take several hours. So yeah.
And the interesting thing is, people always say, well, it's so expensive, it only takes you an hour to do it. There's a great story about the calligrapher Teshu, and the person said, I want you to paint me a beautiful calligraphy, and he painted out, and he said, how long did it take you to do that? And he said 20 seconds and 25 years. Right?
Yeah, that points out there's a lot of training.
Right.
There's a lot of instrumentation. I do a lot of arthroscopy and scopes and towers, and that stuff is expensive.
No, it's not only that, but it's people ask me, whatever people do for a living. I think the years behind that you spend learning a craft and perfecting it and doing what you did, and honestly, it was the best money I spent on my dog. And I would, if I had to do it again tomorrow, I'd be at your office to do it, because it was worth the money, it was worth the time, and it gave Maya. She is literally today as active as she was when she was 4 years old when I got her, and I attest that a lot to that one surgery, because she was limp.
For sure, and that's again, going back to my philosophy as a surgeon. That's why we did the surgery, and. But part of it is also experience. I'm a consumer in other fields, and I certainly understand that. I want this to be a good experience for both the person and the dog. And hopefully that's what we provide. Most of the time.
And in closing, I got to say, you're one of the lightest, coolest people I've met, especially in vets, because they say vet has a very high degree of burnout, being a veterinarian, and a high degree of depression, being very sad. And I'm not sure why that is. Maybe you being a specialist in something, it's different, because your vibe is just I feel like, okay, let's go running now. You're totally inspiring me to do this.
I love that.
And it's just such a great thing to see that somebody who's as good as you are in your field, this positive attitude, this positive thing you do. And any tips for young veterinarians or people who want to be veterinarians? Well,
that's a good question. One of the things that I tend to say is that I get a lot of young people come to me and say, I want to be a veterinarian because I love animals. I want to work with animals. And I just say, that's great. But my job is actually working with people. I have never, so far in my career, had a dog tell me it's okay to do surgery.
Right.
And, so really, again, I work on animals, but I work with people. So if there are, people out there who feel like, they really just want to work with animals, you know what? Become a veterinary technician. You do so. I can't do what I do without my technicians.
For sure.
They do. So much of my success is based on our support staff.
Wow.
From the receptionists to the janitors to our technicians.
Yeah.
There's no way that I could do what I could do without that. And so young people getting into veterinary medicine, it's that whole thing. And if you feel like, I want to work with animals but not with people, this isn't the job, for you. This is a people people's job, as much as people don't realize that, because I get to work on animals.
It's quite brilliant because, like I said, you're a very likable guy. You're affable. You're kind, and that shows through with your animals. But I never thought of that's a very good point. This is my problem with people sometimes.
But I love it. I mean, it's one of my favorite parts, and I mean, it's one of the most gratifying things of my job, especially as a surgeon, is getting to again come talk to you after Maya is back to normal, and get to hear those stories about how maybe I got lucky enough that some procedure I did has restored not only function and quality of life to the animal, but to the family. And people miss that, being able to take their dogs on walks or hikes or playing on the beach, and if I can get back to that, that's why I do this.
Well, I mean, I think you do a great job. I'm so flattered that you came on the show, because it's going to be so educational for people who need to know more about doing the right thing for your dog. And ASEC, again, it's in West Los Angeles on Sepulveda Boulevard. I mean, if you guys are listening in India and Pakistan and Brazil and Germany, wherever you're listening, it's a long way to go, but it's worth it. So anyway,
our website is www.asecvets.com.
Okay.
We'll kind of connect into our hospital if you want to check it out.
Okay.
But otherwise, hopefully, I always tell people, hopefully most of the time you don't need us.
Yeah. I'm going to put a link to the hospital in the description because it is really important. I'm sure you guys have referrals in other places if people need it. Okay, so that's really a good thing. And this is where I would go for the referral if you need it. Thanks for tuning in. Dr. Balfour.
It's been a pleasure, Robert.
Thank you so much.
Thanks.
I'll see you soon. Thanks for tuning in. Make sure you check out my website, robertcabral.com, for all great dog training stuff. And subscribe to the YouTube. And hope you love this podcast. See you next time.